Welcome back. When it comes to women's health, many symptoms are often normalized or brushed aside, but for women living with endometriosis, that can mean years of pain before getting answers. Joining me now is Dr. Tatiana Saavedra, our women's health expert, to talk about what endometriosis is, how it impacts women, and why early recognition matters. So thank you so much for joining us again.
Thanks for having me again.
Of course. So let's talk about endometriosis. What is it, and what exactly happens in the body when you have it?
Endometriosis is when endometrial cells, which those are cells that are supposed to be in your uterus, in a woman's uterus. And what happens in endometriosis is that these cells can start to grow in other parts of the body outside of the uterus. It can be in the ovaries, in the fallopian tubes, but also in the pelvis and even other areas that are kind of distant to that. And so that's what endometriosis is. It affects a fair number of women. Most numbers are about during most reproductive years for women, it's about 10% of women that are affected. And when you look at this globally, it's like 190 million women that could be affected. So it's a pretty significant number.
Now, would you say it's more younger women or midlife or older women?
So the average age of diagnosis for most women is between about 25 and 45, but we do see young girls and adolescents that also have symptoms that are, consistent with endometriosis.
Now, many women experience painful periods, but how can someone tell the difference between a regular, like painful menstrual cycle versus I have endometriosis?
So that's a good question. And I think that's one of the main problems with diagnosis is that some clinicians might brush it aside and say, oh, you just have painful periods. So it's real important to really get a good history from the patient, specifically asking, kind of the pain associated with it, because it might not be just pelvic pain that's associated. You might notice pain elsewhere, which might give you a clue. How heavy periods are, how long they last, and then also like when did you first get your period? Because there's been some risk factors that might put a woman at higher risk of developing it. And sometimes that's young girls who get their period at a very young age. So if, for example, if they got their period before age 10 and they have real painful periods, then maybe endometriosis is on the list of things to look for.
So aside from painful periods and cycles, what are some other symptoms that people might recognize or look for?
So sometimes because of just the proximity of where the uterus is to other things. So some women might have painful urination, even painful bowel movements and things like that, if either the GI tract or the urinary tract is involved. So that's something to look for. And also one that probably doesn't get talked about a lot is painful sex. And so if that's something that a woman's experiencing, then you might want to look into endometriosis as a cause.
Now, what is a treatment option available for women? Is it birth control or is it something else?
So unfortunately, as far as we know, there's not a cure for this. So the best we can do is really kind of manage symptoms, and it can be with medications or even surgical treatment. That's kind of, down the road. But medications, like you said, birth control is a very good option. A lot of women do have improvement in their symptoms with birth control. And then there's other hormonal things that can be used, and it kind of depends on the severity. And then certainly the patient's desire for pregnancy, because if the patient desires to get pregnant, then you might avoid certain hormonal options. And endometriosis does affect fertility for a lot of these women.
Definitely great information, good things to know. And of course, if you have any questions about endometriosis or anything under the Women's Health umbrella, feel free to email us at getanswers@LouisianaFirstNews.com, where we can get those questions answered for you. Dr. Tatiana Saavedra, thank you so much for joining me this morning.
Thank you.
Of course, stay right there. More news, weather, and traffic coming up after the break.